The NHI is now law, but as things stand, not everyone will be covered when it rolls out. At the Public Interest Law Centre, Section 27, Sasha Stevenson is leading the push to change the Act to give everyone who lives here access to the same health services. Sasha, thanks for your time today. Why should foreigners get free access to public health care in our country if we pay for those services with our tax money?
So there are both legal and public health reasons why the health system doesn't distinguish between migrants and South Africans to a large extent. The National Health Act says that everyone is entitled to primary healthcare services, which is generally services at clinics. Everyone who is not on a medical aid is entitled to receive those services for free. So that's the first thing, everyone regardless of whether you're South African or not. When it comes to hospital services, South Africans and refugees, asylum seekers, and undocumented people from SADC states are entitled to be means tested to determine the extent of subsidization at hospitals, so to get those services. And then when it comes to services for HIV, there are various revenue directives from over the last many years that make it clear that we shouldn't be distinguishing between people essentially with IDs or without when it comes to HIV services. And then finally, pregnant and lactating women, so pregnant and breastfeeding women, and children under the age of 6, unless they are on medical aid, are entitled to free healthcare services at both clinics and at hospitals.
So how does it work if you access a healthcare clinic without an ID? Because my understanding is that generally you need a form of identification, right?
You do, and of course it makes it much easier, and it's important that we keep those records. But there shouldn't be a blockage to accessing services. If somebody doesn't have an ID, whether they're South African or not, they should be able to show their identity in other ways because of the public health consequences of having some people not treated within a community.
If we look at the future of healthcare in South Africa under the NHI Act says that people who are undocumented and asylum seekers won't be able to access HIV services. Why is that?
That's right. There's no good reason for that. In fact, it's a disastrous decision. South Africa has the biggest ARV program in the world. And we have the biggest ARV program in the world both because it's been fought for by activists and because we need it, because we have such a high burden of HIV. If we start distinguishing in who we are treating between South Africans or refugees versus asylum seekers and undocumented people, our HIV epidemic is going to grow. At the moment, anyone is able to access services for HIV, whether that is testing or counseling or treatment. Under NHI, the plan is to draw those services back. That's regressive.
In the Act, it says that only notifiable diseases qualify for free treatment when it comes to certain groups of people. Now, why is HIV then not a notifiable disease?
We know in South Africa, HIV has always been a stigmatized condition, and there's concerns about creating further stigma through notification. But the other thing is that our surveillance systems around HIV are already fairly advanced. We already have really good processes for the testing and the treatment of people living with HIV, for ensuring that if someone drops off treatment, that they're brought into treatment. So we don't need the condition as it stands to be a notifiable condition. And that's why HIV isn't listed amongst notifiable conditions, although other conditions like tuberculosis are.
Section 27 is clearly not happy with the NHI Act as it stands now, particularly the section that pertains to foreigners. What are you doing to change that?
So Section 27, together with its partners over the last 10 years, has made a slew of submissions on the various iterations of the NHI bill, from the white paper to the 2 versions of the bill and to the regulations that have recently been published. And again, we've raised concerns about elements of the bill and now the Act that are unconstitutional, and that in particular will risk disadvantaging further the vast majority of people in South Africa who use the public healthcare system. We have been instructed by the Treatment Action Campaign to intervene as an amicus curiae, so a friend of the court, in one of the challenges to the NHI Act, the Sama case. And then the concern that the Treatment Action Campaign has is related to population coverage. You know, NHI is supposed to be a universal health coverage system, and yet it directly excludes a population that's currently included in access to healthcare services.
Sasha Stevenson, thanks very much for your time today.
Thank you.